Hi, everyone. Dr. Elizabeth Bonet here. Dr. Liz, welcome to the Hypnotize Me podcast. Before we jump in, please note that the podcast is not mental health treatment, nor should it replace mental health treatment. If you need psychotherapy or hypnotherapy, please seek treatment from a trained professional. I do hypnosis all over the world, so please feel free to contact me through my website, drlizhypnosis.com, DRLIZ hypnosis.com. Hi, everyone. Dr. Liz here. We're going to talk about safety this week because I get quite a few questions from people around safety and hypnosis. Before we do that, remember I am running a special promotion that you get a free mask or two for leaving a review either on iTunes or Google. This helps the podcast get found. When it gets found, then people are able to help themselves through the free hypnosis files as well as the information. Or someone can get connected with someone that they vibe with, that I interview, or myself, someone that they feel comfortable receiving help from. So if you like surprises and you want a free mask, this is only open to the US listeners. Sorry about that, but due to shipping and the way it's handled right now, I can't ship internationally. But just leave a review, take a screenshot, email it to me, Dr. Liz at drlizhypnosis.com with your address and your name, and I will send you out a free mask or two. You can let me know color preference, but the selection is random. It depends on what I have on hand. I make these myself. I love making masks. I've made well over 100, and they're double layer. One layer quilting cotton, and the other layer is either flannel or quilting cotton. And they have super soft ear loops. They're not for medical use, obviously. They're for personal use, but they are some really fun masks. People seem to really love my masks. All right, let's talk about safety. Safety is super important in hypnosis. I actually think it's super important in any type of psychotherapy or help that you're getting. You really need to be able to trust the practitioner and know that you are safe with them. Now, people have varying levels of trust based on their history. It's funny, I was in a workshop once, and this was a big group of people, pre-COVID, obviously, and they asked us to close our eyes. And then they said, those of you with trust issues, don't peek. And I just sort of cracked up because I always want to peek, but I never related it to trust before, but it's totally related to trust. So that's to say, we all have our different levels of initial trust with someone based on our histories. So that's going to take a while to establish. Trust is a continuum, right? It's not an either or. It's not a black and white. It's not I totally trust you or I totally don't. It is a continuum, and trust grows over time, over years with friendships or marriages or partners. It can be taken away, right? It can be broken. It can be rebuilt, but it's not just a decision generally. Or at least I encourage people to think about it as a continuum. So we all start at different places on that continuum, depending on what's happened to you in your life, depending on what kind of parents you had, depending on your siblings sometimes, or something that happened to you in school or with friendships. But in general, the goal is to really feel safe with someone doing psychotherapy or hypnosis with you. Now, some safety is built through their reputation, right? How long they've practiced, what's their training, what are their reviews, does your friend know them and trust them and referred you to them? Some of those things come from what we call social proof these days. For some people, if someone has a presence on social media, any kind of presence, that helps them feel reassured. For other people, they don't care so much about that. It's more word of mouth. For other people, it's an energetic thing when they talk to them on the phone or they meet them in person for the first time. How do they feel? And for others, it's really about training. Are they well trained? Now, I am going to recommend that it depends on what you're working on when you go see someone. But if you're working on trauma or deeper healing, you want to make sure that person is well trained, right? That they do know about trauma, that they have studied it, that they've worked with people with trauma before, that they know how to handle what comes up, and that their primary goal is to keep you safe. So that is always my primary goal when I'm working with someone with hypnosis is safety. I do not want you re-experiencing trauma. I do not want you in it. So I have all kinds of techniques that I use to create some distance from the trauma so that we can learn what we need to learn to be able to heal, to be able to rewrite it in the brain, to be able to integrate it. Because we know with trauma, it gets actually encapsulated in the brain. It doesn't get integrated, which is why it stays a traumatic event instead of feeling like you're past it. So my goal is to keep safety, create safety, help you through that, handle whatever comes up, and then help you integrate that into the brain so that it no longer feels like a traumatic event for you. You'll still be able to identify it as a traumatic event. Like, yes, this happened to me, but you won't have the emotional intensity that comes along with it or the symptoms that are holding you back in life, preventing you from doing things that you want to do or preventing you from feeling ways that you want to feel, feeling better, feeling stable, feeling recovered, feeling grounded, feeling good. Right? Less anxious, less depressed, able to handle things and manage your life better, your children better, your partners better, or go out and find a partner. Someone to love who loves you and choosing a good one. Trauma often has an impact on who we choose as partners and on our partnerships once we're in them. So when you heal trauma, then you're also going to have an impact on those relationships in the positive way. Now, in the hypnosis world, technically, if someone gets caught in a trauma or is having a huge trauma response in the middle of hypnosis, we call that an abreaction. And that's really just a technical term to say that they're in it. They feel like they're re-experiencing it instead of having distance from it. And any good practitioner has been trained about how to handle abreaction. Now, mostly we try to prevent it, period. Okay. Like we don't want someone re-experiencing it, like I just said. But occasionally it can still happen. I've had one or two since I've been trained in hypnosis, which has been 6 or 7 years now. So we can't always predict what's going to happen, right? Like we know that too. When I'm doing deeper healing, then how I explain it is that we are doing a relaxation phase where we're slowing down the brain waves because we know that healing can occur faster in the slower brainwave states. And then we're doing an exploration phase where we're seeing what happened. And then we're doing a healing phase. I can't predict what's going to happen during the exploration phase, what's going to come up, what's not. People have theories often. They think, well, I think this is related to this trauma, and we can go into it with that theory, but I don't always know. And often we are surprised at what comes up, what memory was impactful. But my whole job there is to guide you and keep you safe, and then help you integrate it and heal it. So hypnosis practitioners use a couple of techniques, and I'm sure people use all kinds of different ones that probably I don't even know about. I don't know. But one of the main ones that we learn is having someone look at the trauma as if it's on a movie screen. So this creates some distance. And again, it depends on the person. Some people get really involved in movies, right? Or sometimes you'll have someone that says, I feel like it's a movie playing over and over in my head. Well, then that technique may not be so helpful for them, right? Then you have to use something else, like you're a fly on the wall, or you're seeing it from afar. Like there's different ways to create distance for someone so that they're not caught in the trauma. And that's just a couple of common ones that I'm throwing out there. So it is a really important question to ask anyone you're thinking about working with. And then listening to your gut feelings around their response. to make sure that you have at least a base level of safety. So trust and safety, are they going to grow with the relationship? Yes. And this is why I don't do trauma work in one session, in the first session, never, because we do need to establish some safety and trust. And that can be done pretty quickly within a session or two. But for me, also, it's a relationship, right? That is why we do that first session, why most therapists do that first session. When you're talking about smoking or something like that, then often you can go in for one session and it's done. But that's really the only circumstance that I'll do a single session with someone in my practice. It's like, yep, you can do one session, stop smoking. It can be effective. 3 to 5 sessions are much more effective to stop smoking, according to the research. And I have to wonder if some of that is trust, making sure that you have a certain level of basic trust that this person truly is trying to help you and has good, honest, ethical intentions. So I hope that helps you understand safety better in terms of hypnosis or whatever type of healing that you're looking for. I hope you have a wonderful week and that you're healthy and safe. Peace. I hope you truly enjoyed today's episode. Remember that you can get free hypnosis downloads over at my website, drlizhypnosis.com, DRLIZ hypnosis.com. I work all over the world doing hypnosis. So if you're interested in working with me, please schedule a free consultation over at my website, and we'll see what your goals are and if I can be of service to you in helping you reach them. Finally, if you liked today's episode, please subscribe to the podcast or tell a friend. That way, more and more people learn about the power of hypnosis. All right, everyone, have a wonderful week. Peace.